Hello, my name is Joel Dunning. I'm CTS Net Editor-in-Chief. Thank you so much for inviting me to talk at your excellent conference, the International Conference for Thoracic and Cardiovascular Surgery, organised by the AAPCHS and the AATCVS. I'd like to give my extra special thanks to Professor Martin Agahi for all his vision and leadership over many, many years. I've known him for a lot of years and I've so admired his leadership, and I would like to give my personal congratulations to him on his appointment as Emeritus Professor of Cardiovascular and Thoracic Surgery. I'm really sorry I can't be there in person. As I'll say a bit later, I was actually on a mission in Accra, Ghana 2 weeks ago, and unfortunately I couldn't stay long enough to attend this meeting. But I do have a deep and lasting passion for developing world and Africa in particular, and the betterment and improvement of cardiac surgery globally, as I will mention. And really that is the reason that I'm so happy to be talking to you today, because I really want to reach out on behalf of CTS Net to see how we can work better together for the betterment of our learning and education. And at the end of the day, it's all about improving the care to our patients. So I'll just tell you a little bit about CTS Net. CTS Net is a website, ctsnet.org. It has 4 million page views per year. We post 200 videos per year. We video and live stream 20 conferences. We do live webinars. We do expert series. We post news articles to help you find the best articles, and a whole lot more. So we're quite big, and we really are a great resource. Now, just to give you a bit of background, we are in fact 25 years old, which doesn't seem like a long time, apart from this is for a website. We were created by Robert Leplogle. Now, he was a real visionary. Back in 1995, everybody was looking at this strange thing called the internet. What on earth is this thing? You know, what a waste of time. Some geeks are going to get into this thing. But he thought this would be great for getting the STS educational materials out to a network of surgeons. He also had the amazing vision of being collaborative. So he didn't just keep this for the STS, he reached out to AAPCHS and the AATS and said, let's do it together. So we began being the website for the 3 biggest societies in the world, and those were our origins. So we started being their website because they didn't have the skills and ability to run their own website. Very quickly, over 25 other organizations joined us where we hosted their websites. Now, for about a decade, we were a website hosting service, showing the world what you could do with each of these societies. But actually, things changed. It got cheaper and easier to run your own website. So as all the societies started to get their own websites, we evolved, we changed. We started saying, well, surgeons are starting to video their operations. You know, cameras are turning up on phones. People are being able to video their own things, and they even have endoscopic stacks. So after 10 years of existence as CTS Net, we changed, we morphed. We started receiving videos from surgeons because this is a transformational way to learn. When I started out in surgery, which was around about that time, you had to get on a plane and go and see a surgeon if you wanted to see something extraordinary or different. And if you wanted to see something rare, it was virtually impossible because you just couldn't organize the travel. So we evolved, we started receiving these videos and putting them out there for people to see. And this led to a whole wave of learning via internet videos. So really, for the next decade, we have become an internet video hosting service, helping surgeons to get their videos out there so you can see them. And I really hope a lot of you have already watched many, many videos to help you improve your surgery as you go and address ever more difficult cases. But as we enter our 3rd decade of existence, YouTube came along, and surgeons find it more and more easy to post on YouTube. So we just have to get better. So what we're doing now at CTS Net is professionalizing. We want to take your videos, make them look way better. We want to publicize them, get them out there. We're going to get professional video crews and go out and video surgeons doing surgery. And so we really want to create in the next 5 years CTS Net TV, CTS Net Professional, and go much more global. So I think we still have a really exciting future at CTS Net. And it's really important just to remember that we are owned by the 3 international societies, and our mission statement is to help cardiothoracic surgery training worldwide and to help people like you. We are a 501c3 charity. We're not meant to make money. We're meant to spend all our money on helping you educationally, which is why we want to make the best videos we can. So we have 50,000 surgeons registered, and that's actually registered on our profiles page. If you log in, you can find the emails of 50,000 surgeons around the world, so you can reach out to them and ask questions. It's a real advantage of our website. Let me just tell you a few things that you could find on our website. We break it down into categories. We're also really pleased that we've got some extra awesome editors that work with us. So for cardiac, we have got a brilliant female surgeon called Lorena Montes. She actually works in Colombia as a cardiothoracic surgeon, a cardiac surgeon, and she is our cardiac editor. If you click on our cardiac portal today, you will find brilliant videos such as repair of giant coronary artery aneurysms, repair of giant left atrial aneurysms, and we've got a brilliant webinar from the ASAIO meeting recently all about the latest in total artificial hearts. So loads and loads of cardiac videos, because 70 to 80% of our viewers are cardiac surgeons. We know that in Africa, there's a huge number of congenital cases, and we've got a brilliant editor, Sami Syed. He's from Westchester in New York, and he leads our congenital portal. We have got a huge number of congenital videos. We actually probably post far more congenital videos than the percentage of congenital surgeons we have. We've got about 10% of our surgeons are congenital, but we do way more videos, and they're really, really good. We've had a big wave of the Nikaido procedure for transposition of the great arteries. So check out some of those. Looks more simple than previous techniques. Really nice. We had a lovely video published recently with off-pump reconstruction of the pulmonary artery in an infant, which I really liked. And there's quite a lot of videos for things like anomalous origin of the left coronary artery and many, many more. There are some webinars as well, and lots for you to look at. So if you're mainly doing congenital, check out the congenital specialist portal. Thoracics is led by a young thoracic surgeon in Guys and Tommies in the UK called Liane Ashrafian, and there's loads and loads of really interesting thoracic videos. Up on there at the moment is left main bronchus tracheobronchoplasty, a beautiful video of how to patch a left main bronchus with a mesh for people with tracheal malacia and collapsing tracheas. Really, really nice. There is a lovely video on wristed instruments. Have you ever seen articulated wristed instruments for your minimally invasive operations? And we do loads of things like technical pearls for diaphragm plication. So check out our thoracic portal. Now, as well as our main categories, cardiac, thoracic, congenital, and we have transplant in there as well, of course, we like to produce videos that will be as helpful as possible. So we've got a whole portal called step-by-step guides. And in those step-by-step guides, you can find things as basic as how to put a chest drain in, how to take out pacing wires, stenotomy, open and closure, and slightly more advanced things like aortic valve replacement, step-by-step, proximal and distal anastomoses, posterolateral thoracotomy, and more basic things in a step-by-step guide. So we really like that, and it's aimed a little bit at residents and more junior people. we have a section called the Giants of Cardiothoracic Surgery. We've gone around the world and tried to interview the very best cardiothoracic surgeons around the world to try and learn from them, really. And over the years, we've done interviews with Jim Cox, Randolph Chitwood, Magdi Yacoub, Pat McCarthy, Joel Cooper, Peter Capitan, and many, many more. There's about 30 Giants interviews, just learning from their multi decades of experience in our specialty, all about 20 minutes long, and I really like those. If you want a bit of a regular update on the world of cardiothoracic surgery, I hope internationally, then I'm now doing a weekly podcast. In this podcast, I let you know everything that's new and exciting on the website, and I tell you our best 3 videos, and I also tell you the best 3 news articles of the week. So if you don't have time to keep up with the journals, then just listen to our podcast on your drive into work. And I'll tell you all about it. I also highlight events coming up and any little extras and specials. So if you tune into podcasts, wherever you get your podcasts, go and check out The Beat with CTS Net. It's a really nice little thing. Now, if you ask me, what could you do today with CTS Net? Well, if you haven't registered, just register and put your profile onto CTS Net. This is completely free. You could even use it as your own website if you don't have a website, because they'll come with a nice little handle, ctsnet.org/your name, so mine/Joel Dunning. You can put all your achievements, you can put any videos you post, you can put your papers there, you can put pictures. So if you don't actually have a website yourself as a surgeon, just pop on CTS Net, register everything, and but hand it out, put it on your card. Why not? That's a little service we recommend. A lot of people aren't aware that we hold competitions, and I've just announced this week the winner of our innovation video competition. This comes with a $1,000 prize, and this prize was won this year by Ahmed Ali Amir Gofran, and he's from Tehran. I was delighted to get a fantastic video from Tehran. It was really great to see a Middle Eastern winner this year, and it was a really good procedure. So he has designed a brilliant operation. So for many years, he's actually created pulmonary valves out of the right atrial appendage. He cuts off the right atrial appendage, he sizes it, and then he uses it as a valve, which I thought was fascinating. He's done it over 141 times. And this video is about him doing the same, taking out the right atrial appendage, but putting it in the tricuspid position to use. And he believes that it actually can grow with the patient, and he's getting really great results. A brilliant solution when a biological valve is too expensive or you need growth. And just wonderful to see that the winner of our international competition is from Iran. Just a little bit more information on our journal and news scan. We call it JANS. If you register for this, but with your email, every single week we will send you an email that tells you the latest and greatest journal and news articles. We've actually got 5 junior residents and middle grade residents who go and look through the literature. I have a look as well, and we bring you all the most interesting and exciting articles. So we bring you guidelines like the new coronary revascularization guidelines that have been very controversial in the USA, GGO, ground glass change guidelines from the ESTS just last month. We break news like Partner 3 trial about TAVR versus surgical AVR, and even interview the first author, Michael Mack. So we tell you about everything that's new and interesting that's going on in the world. Now, an interesting thing, if you would like to submit journal and news scan articles for CTSNet, you're very welcome to do it. Just send us an email. Send me an email, joeldunning@doctors.org.uk or jdunning@ctsnet.org, and become one of our submitters. If you see an interesting article, if you've written an interesting article, let me have it and I will post it to the world for you through CTSNet. So register for our weekly email for JANS. One other little interesting thing we do every month is a featured profile. And interestingly, this month's profile is of Penelope Adinku. Penelope is a consultant cardiothoracic surgeon in Ghana. She's in fact the first female cardiothoracic surgeon, and we have an interview with her. And actually, profiling her on CTS Net has got us some great response from surgeons in America, even got some invites internationally. And so if you want to be profiled, then we'd love to hear from you. You tell us what you're doing that's new and exciting, and we might profile you as well on CTS Net. Now, just in the last 6 minutes or so, because I don't want to honk on for too long for you, but I'd really like to tell you about what I would like as CTS Net Editor-in-Chief with regard to our CTS Net Global Portal. This is led by Emily Farkas. Now, I have so much respect for Emily Farkas. I met her back in 2018. I was very kindly invited to the African Association of Cardiothoracic Surgery meeting there. It's in Nugu, where I met Martin and many of you, and Frank, Edwin, and lots and lots of people there, and there in 2018, Emily Farkas was also doing a mission. She was doing a mission to Enugu, performing surgery in that hospital. And that just was so wonderful and such a really positive thing to do in cardiothoracic surgery that I came straight back, and we have started performing missions as well. And we've just recently come back in the last 2 weeks from Ghana, where we led a team helping Abidjan at UGMC do some advanced cases, aortic surgery cases. And we also sent some people to the National Cardiothoracic Surgery in Accra to help Enso Mensah and his fabulous team there performing some surgery. At the same time, we set up some pacemaker missions and brought some reconditioned pacemakers and some expired stock to try and help surgeons and cardiologists in Ghana doing surgery. So I hope this just goes to show that I actually have a deep and lasting desire to really promote global cardiothoracic surgery. I really believe that every Western unit should buddy up with a developing world unit to try and help them personally. We're trying to promote that on CTS Net. So I would love your help with this. And the most important thing from our point of view is to listen to you guys. We have to listen to what you want. We've tried to do this with BAFOR and the people in Ghana to ask, what help do you want? Which is why we did an aortic specific mission, because there was a desire for aortic surgery. That's why we sent a perfusionist and an anaesthetist to National Cardiothoracic Surgery Centre, because they asked us. I'm also a trustee of a charity called Pace for Life. We have lots and lots and lots of reconditioned pacemakers. We take these from funeral directors, and these have got 10 years of battery life in them. And for those countries that will receive them and have them FDA approved in their country, we can gladly receive them. Also, we have a large amount of expired stock from a national charity in the UK, and we can send them to you. And we handed out a lot of those to surgeons in Ghana, in Nigeria, and we hope to engage with many, many more people. So if you are interested in us helping you with pacing or surgery, do get in touch. And I think it's really important that we listen in the West and to try and ask, how can we help you? On the global portal, led by Emily Farkas, who has a long-lasting attachment and desire to help in Africa with Cardiostat, her own charity. She has 5 different sections at the moment. She's got global surgical volunteerism. It's a list of places that need help and a call for help from around the world to help units. We have a section called cardiac surgery in low and middle income countries. Hints and tips and just videos about previous missions so that anybody coming out can learn how better to help in Africa. We have a surgical pearls and pitfalls area just to try and help people sort of learn from people's experiences. We have organizations and opportunities where we try and list the units and the charities so that anybody interested can engage with us. And we're really pleased to have done a load of interviews with people who are involved in globalism of cardiothoracic surgery. We recently interviewed Charles Yanker, who many of you will know from the Berlin Heart Center, who's got a long and lasting history of interacting with mid-Africa. We've talked to Bode Falase from Lagos in Nigeria, Professor Barasa Otsula from Kenya, and we've actually recently even talked to Glib Yemets from Life as a Cardiovascular Surgeon in Ukraine. And we'd love to talk to you. If you'd like to tell us about your fabulous unit, do drop me a line at CTS Net, and we will spotlight your practice and what you're most proud of and where you'd like your unit to be in the next 5 or 10 years, perhaps. So there are so many ways that we can interact. I've recently had some emails from Keleki Akonta in Port Harcourt. He said that with the Nigerian Journal, we may be going to set up a best evidence topic area where we can summarize the best evidence for different topics for subjects in cardiothoracic surgery. That would be really exciting. There are things that I think we can help with. So really, as I come to the end of this talk, and thank you once again for being so patient listening to me, maybe the final question I might pose is how can we engage? Well, most simply, let's talk by email. Send me an email. My best email is probably Joel Dunning, all one word, JoeldUnning at doctors.org.uk. And so drop us an email. You could contact us directly through CTS Net if you like. Maybe if you've got a camera or somebody to video, or a head camera or an endoscopic camera, record something you're particularly proud of and send it to us and show the world what you are doing, just like that wonderful video from Iran that actually won $1,000. Maybe you would like to send us some journal and news scan articles, some articles maybe you've read or anything really interesting. Just pop on and submit some comments about the articles that we post as well. That would be nice. Maybe you have a need. Maybe you have a need for pacemakers or a surgeon